Chronic pain is a widespread health issue, with 50% or more of veterans reporting pain as a concern to their primary care provider. VA has adopted a stepped care model for pain to address chronic pain across the spectrum of care at VA. Step 1 level care includes primary care teams who manage the majority of patients with chronic pain. Multimodal care, aligned with the biopsychosocial model, is preferred for managing pain. Psychological intervention, such as cognitive behavioral therapy, or CBT, can address multiple aspects of pain and is a recommended component of biopsychosocial pain care in the VA. However, CBT for chronic pain is typically offered in specialty care settings. In order to provide better access to care, Brief CBT for chronic pain was developed for use in primary care mental health integration, or PCMHI settings, as well as other integrated care settings. This approach provides veterans with treatment that can improve pain-related functioning. Brief CBT for chronic pain is designed to introduce patient self-management and improve pain self-efficacy. This treatment is a highly focused approach that uses patient-identified goals to direct the course of care. Brief CBT for chronic pain is suitable for most patients, bearing in mind the targeted nature of the treatment. Those who are most likely to benefit will have one or more of the following characteristics: mild to moderate impairment and distress, receptiveness to non-pharmaceutical pain management approaches, no severe mental health or substance use disorders, and no imminent safety risks. Today is our veterans' first meeting with a mental health provider on the PCMHI team, following a warm handoff from the primary care provider. Our veteran and mental health provider have discussed the veteran's pain experience and are beginning a collaborative treatment planning discussion. Notice how the mental health provider is able to effectively offer psychoeducation about Brief CBT for chronic pain and engage the veteran in a discussion about how this might fit his treatment needs.
Well, thank you for walking me through what's been going on with regards to your chronic pain. It sounds like you've been living with it for quite some time, and you've been a little hesitant to reach out to a provider about it. Now, it also seems like it's caused you a great deal of personal difficulty in that you have to miss family events because of the pain.
Yeah, definitely. I feel like it just got to a point where I needed to ask for help. I probably should have said something before, but just got to a point where I had no other choice.
Sure.
The way I've been dealing with it is just pushing through, but it's not working anymore.
Yeah, there's often that pressure to just push through, right? And that's something we commonly hear from the veterans we serve here. And as someone who served in the military, I'm sure that's a message you often receive. You've just got to push through this.
Absolutely. We used to say pain is weakness leaving the body, but something needs to change.
Well, we like to take a different approach here, something that you may not have tried in the past. Would you be open to me spending a few minutes talking about a treatment that I think might be helpful for you?
Yeah, I got nothing to lose at this point.
So there's been a lot of studies conducted over the years about the best way to manage chronic pain. And what we've learned is that pain is best treated by something called the biopsychosocial approach. Is this something that you've heard of before?
No, not really familiar with it.
Well, that's not uncommon. A lot of people haven't heard of it, but chronic pain has to be managed similarly to other chronic conditions in that we really need to tackle it from all sides. So the biopsychosocial approach really just means that pain can impact or be impacted by a variety of factors, some of which you may not have considered before. For example, biological factors such as inflammation and weather changes can really turn up the intensity on the pain. And focusing in on the pain or dwelling on worst-case scenarios are psychological factors that can increase the intensity. Having support or lack of support from others can make a difference as well. And to the point that you made earlier about pushing through the pain, overdoing it can also lead to these pain flares.
Oh, yeah. When I start a job, I don't want to stop. But, yeah, you're right. I have to lay in bed for a couple days before get back at it.
Exactly. Those are the exact types of patterns that we're referring to. So the specific treatment I'd like to recommend for you is called Brief Cognitive Behavioral Therapy for chronic pain. And this treatment really helps to address a variety of factors and hopefully help improve your experience with pain. So the main goals of CBT is to help you cope with pain in the way that you can live a more fulfilled.
Yeah, but I'm still not sure how therapy has anything to do with my pain.
Sure, and that's a fair question. So Brief CBT for chronic pain is more about developing pain self-management skills so that you can reduce the amount that pain interferes with your day-to-day functioning.
Yeah, I'm just curious about, like, how does it work? Does it include medications?
So Brief CBT for chronic pain is really focused on lifestyle changes and doesn't really include medications as a part of it, although they can be used alongside it. So we typically recommend that our patients continue working with their primary care providers and specialists to manage their other medications and medications they may be considering. Now, this treatment consists of 6 modules that are 30 minutes apiece, and it's not your typical talk therapies that you may be familiar with. It's really focused on pain management. So you may even think of it as more of an educational or training workshop because you're developing new skills. So with each session, you'll develop a new pain management skill, and we'll be working really closely to help fine-tune those skills. The first module is already set. I'll be providing you with a background on chronic pain, and we'll work together to set goals on how to move forward. And from there, we can choose from a variety of modules, one of which that I think might be helpful to you is called activity pacing, because it'll help talk about ways to avoid those pitfalls of overexertion leading to pain flares.
I do like that for sure. But what are the other topics?
Yeah, there's relaxation training, where this helps you come up with different ways that you can address reducing tension in your body when you're maybe feeling distressed or if you're having high levels of pain. There's also cognitive coping, which helps you to address unhelpful thought processes. One thing that we find very commonly with our patients with chronic pain is that they typically have more negative or unhelpful thoughts. And that's not unusual considering living with pain is a very unpleasant experience. So what we hope to change is the way that you feel about the pain and feel about yourself. So it's a little new to a lot of our patients, but it's a critical component of the biopsychosocial approach. So at the end of all the sessions, we'll work through all of the skills that we've learned together and create an action plan for moving forward. One other thing that I'll mention is at the end of each module, we'll talk about ways that you can practice these skills. So I strongly encourage that in between sessions that you practice these skills in real situations. Because if you think about it, our time together really totals to about 3 hours. So in order to maximize the benefit of this treatment, that practice between sessions is really essential.
Gosh, thought I was done with homework. What's that like?
Well, I bet you didn't think you'd be walking out of here with a homework assignment, right? Well, this is a very different type of homework. One of my goals is to really provide you with as many skills as I can to add to your toolbox. So one way that we can tailor the tools that you have is by having you practice in real life situations. And then if you encounter any barriers or challenges, we can discuss that at our next session and really work through and create a solution together. I'll also be providing you with a patient guidebook that we'll use in each of our sessions and that you'll get to keep at the end of the treatment. And this will cover all of the topics that we'll be talking about together. It'll help guide you through that practice in between sessions as well as track your practice. And it also includes real life stories of people coping with chronic pain.
I guess I'm just wondering, does it work? How does it get rid of my pain?
Yeah, I'm glad you asked that. So Brief CBT for chronic pain is really focused on pain management and coping with pain. So I can't promise that it will eliminate your pain, but it'll help you learn how to respond better to the pain so it's less overwhelming to you. And as I mentioned earlier, with all of these studies that have been conducted, we found that patients using this treatment are able to reduce the amount of distress and disability as long as they're applying these skills routinely. So to your point, some patients do feel decreased pain after the treatment. Did I answer your question?
Yeah, you answered all my questions. I wish we could get rid of the pain.
Understandably so. It's had a huge impact on your life, and my hope is to really try to get you back some of those things that have been so affected by the pain. Now, let me ask you a question. If we were to move forward with this treatment and it were to help you, how do you think it might change your life?
My family is the most important thing to me, but Right now, I'm just dragging them down. I don't want them to know about the pain. I don't want to be the guy who's just always complaining. Right now, I just stay in because I figure that's better than snapping at everyone, because when I try and go out, I know the pain's just going to get so bad.
Sure, I can see that.
I just want my kids to have a dad who can actually play with it.
Why don't we make that the goal of this therapy? With this treatment, we can really focus in on the areas that matter most to you.
That'd be great.
What do you think about all you've heard today? Is this something you might want to try?
Yeah, definitely willing to give it a shot. Like I said before, I got nothing to lose at this point.
Notice that our mental health provider was able to collaborate with the veteran throughout the session to provide education, fully explain the treatment approach, and discuss overall and veteran-specific goals. Through this discussion, the mental health provider was able to learn more about the veteran's concerns so that these issues could be addressed, thus increasing the likelihood of the veteran engaging in care. At this point in the session, the provider would move forward into the assist and arrange segments of their initial session.